So, you've been diagnosed with breast cancer and have been told you'll need breast surgery as part of your treatment plan. Navigating through all of the medical decisions you'll need to make can be an overwhelming and emotional journey, and there are some things you should know before you get started. A lumpectomy is a form of breast surgery that removes the tumor along with a small portion of healthy tissue surrounding the tumor, but saves the majority of the breast, including the nipple area. While a lumpectomy is considered a non-invasive surgery, it may still leave some form of permanent scarring. This scarring may be visible when you're in a swimsuit or fully clothed. Many women find the visible reminders of their surgery and their cancer upsetting, but fortunately, this scarring does not always need to be so visible. There is an alternative to the traditional approach called hidden scar lumpectomy. With the hidden scar approach, your surgeon will perform this advanced surgery through a single incision that is hidden in one of three places: the natural crease beneath the breast, along the edges of the areola, which will blend into the areola, or in the armpit, usually hidden in a natural fold. This means that even though you will have a scar, it will be very difficult to see. With no visible reminder of the cancer or surgery, many women feel more positive about their recovery and quality of life. Talk to your doctor if you feel a hidden scar lumpectomy is right for you. For more information about your options, visit breastcancersurgery.com.